So veno-occlusive disease is a rare complication, but it can be a devastating one. If people get severe veno-occlusive disease, it carries with it approximately an 80% mortality. So if left untreated, this is something that is life-limiting. So it's a diagnosis of exclusion. So there are criteria that are, at this EBMT meeting, have been updated. And I think there was a presentation a couple of days ago, I think on in fact, yesterday, I think it was Sunday, the new criteria were presented. And VOD, when it occurs, gives you a certain set of symptoms. So people will have weight gain, they will become jaundiced, they will have right upper quadrant pain, they will put fluid on, they can sometimes have renal failure, and they can go then into other multi-organ failure. If left untreated, that progressively gets worse and your patient will die. If the nurse is able to recognise these symptoms and report them nice and promptly to their medical staff, actions can be taken. And it's very important that the nursing behind this is the key to really minimising the effects of VOD. And in fact, any of the complications related to transplants, if you've got good nursing care, then a lot of the complications can be reduced. They'll never be eliminated, but you can reduce them by recognising them sooner and making prompt action. So with things like VOD, you can see things occurring over the period, sometimes only of a day, but often over a period of several days as your patient progressively gets worse. Your nursing staff who are there every day for an 8 or a 12-hour shift will see these changes occurring and can say, well, that wasn't there in the morning. I've noticed in the afternoon this has got slightly worse. Now I'm very concerned as it's coming on to the late afternoon. I need to do something about this. I need to alert one of my senior medical staff or one of my senior nurses to say, I'm not happy with the way this patient's symptoms are progressing. Will somebody come and review them and have a look? I have a worry, I have a concern, I'm not happy. And if somebody does that nice and promptly, fantastic, treatments can be started, your patient can be pulled back often from that brink, but if left untreated, then this progressively gets worse. And as I say, this is the key, is good nursing care, making sure that their observations are done, that you're talking to your patient, you're checking their bloods, you're weighing them, you're doing measurements of their abdomen, and really making sure that things are happening as they should happen in a timely fashion.